Good afternoon. I'm Lori Matson, President and CEO of the Tri-City Regional Chamber. It's my pleasure to welcome you to today's luncheon, The State of Healthcare, Tri-Cities Hospitals Update, sponsored by Basin Pacific Insurance and Benefits. Today, Reza Kaleel, CEO of Kadlec, Joanie White-Wagoner, CEO of Lourdes Health, and John Solheim, CEO of Trios Health, will deliver updates on their hospitals, including economic impacts, upcoming projects, and COVID-19 effects. After their presentations, the CEOs will be answering pre-submitted questions. But before we get to our program, I have some exciting news to share. Thanks to the generosity of Washington River Protection Solutions, the Small Business Incentive Program is being offered again this year. Now, in its 11th year, the Small Business Incentive Program helps strengthen local businesses by providing grants to purchase key products or services. Washington River Protection Solutions has been our partner since launching the program in 2011. We couldn't be more thrilled to offer these funds again to small businesses in 2021. Joining me from WRPS is President and CEO John Eschenberg. Hi, John. It's great to see you.
Hey, Lori. How are you?
I'm good. I wish we could be in person, but this works for a little while. Hopefully, we'll be back in person soon.
All right. Thanks. All right.
So thanks so much again for you and your team for sponsoring and providing funds for our Small Business Incentive Program for our 11th year in a row, $30,000 to small businesses.
Lord, thanks. And again, and good afternoon, everybody. A little unusual, this format, but we're all getting accustomed to it. Lori, as I reflect back over our relationship since 2008, WRPS has partnered extensively with the local chamber. For years now, we've been the primary sponsor for three of the major programs, both the Women in Business Conference, which generally draws about 1,000 people in, the Meet the Buyer program, which has been received very well by our community. And then lastly, as you point out, the program we're going to highlight today is the Small Business Incentive Program. As you say, it's 11 years for our sponsorship. This particular program, the Small Business Incentive Program, has really allowed us to reach 355 individual businesses, granting $330,000. And this summer, we're excited again to announce, partnering with you, Lori, and your team, another 30 winners will be selected. So with that, or maybe you can just tell folks a little bit about how the program works and, get your paperwork in because the window closes in early July. Lori, just if you would give them the details.
Sure, absolutely. So the application process opens on June 7th and it goes, as John said, till early July, which is July 2nd. All of the applications are processed online as our office is still closed for a while. But you can find the application at tricityregionalchamber.com on June 7th. And again, as John mentioned, this year we'll have 30 winners that we're providing $1,000 to. And we're going to do something similar that we did last year is we're going to pick all of the winners via a live drawing in mid-July, and we'll let that date be known fairly soon. So applicants can apply for really any COVID-19 related items that they might need help with and or any other items. We have, you can apply for PPE for your employees or your customers. This year, we're also providing rent or mortgage assistance if you need that. You might need marketing assistance, signs, banners, brochures. You can apply for software, hardware, any type of equipment for your business as well. And again, all of that information can be found at tricityregionalchamber.com on June 7th.
So, Lori, if I could maybe just maybe close out my portion of this with just to give perspective. At Washington River Protection Solutions, we are so committed to our small business community. And to date, now 13 years, we've donated or we've done business to the level of $1.5 billion with small businesses in the area and in our community. So we're very proud of that record and look forward to a continuing track record of success. As I reflect back on, and as we all know, the small business community is really the one that drives our economy at all levels, both local, state, and national. And we're just as pleased as we can be to be a part of that. So, Lori, thanks to you and your team again.
Well, thank you. You've been a phenomenal partner. And, yesterday we were kind of rehearsing today's luncheon, and we were talking about businesses that this has impacted. And we learned that our very own chamber board chair, Shay Frechette and Frechette Winery, received a grant a number of years ago. And we wanted to bring Shay in and really just hear firsthand from a business that applied and benefited from something that when they were just starting up, that was really useful. And again, this is what we're hoping these 30 businesses will receive this year. Shay, tell us a little bit about your experience.
What a treat being in a community where you have businesses like Washington River Protection Solutions that value small businesses enough to do this for these past years. So for Frechette being a new business, we had a point of sale system that really got in the way of us being successful. It was partly written, partly electronic. And this opportunity with the Small Business Incentive Program came around, and we applied for it. And we were one of the recipients of this amazing award. And it gave us the opportunity to upgrade our point of sale system where things are just in one place. And we were faster and we're able to deliver a stellar wine experience for our customers. So thanks again to John and to Washington River Protection Solutions.
Thank you, Shay. And as John mentioned, that's just one of 355 businesses that have been helped over the last 11 years with this program, which is really just phenomenal. So, John, I want to thank you for your time today. I know you're very busy, but mostly just thank you for your partnership as well. And Peter Bankston and your whole team there, we really just genuinely enjoy working with all of you. And we appreciate that you continue to make this program a priority within your organization. And again, just as a reminder, if you meet the criteria, you can find this on our website on Monday, June 7th at tricityregionalchamber.com, and then you'll get put into a live drawing and we'll draw 30 businesses. So thank you both. John, thank you so much. And Shay, we'll see you in a little bit.
All right. Bye-bye, guys.
All right. Thank you. Perfect. All right. So over the past 15 months, the local business community has been really hit hard by the health crisis, but we're pleased that businesses are still joining the Chamber and engaging with our organization for the first time. And I have the pleasure of welcoming the Chamber's newest members. So please help me welcome Non-Vintage Wines, Stephen Tees with Country Financial, Water to Wine Cruises, Axe Keeper Axe Throwing, Holiday Inn Express, Divinion, Valley-Wide Cooperative, Tri-Cities Infusion and Wellness Clinic, Verbruggen Palletizing Solutions, Dance Connection, and Movement Mortgage. I'd like to thank you all for joining the Chamber. We look forward to your engagement in our organization. And next, it's my pleasure to announce the May Member of the Month. As you know, over the past year, the Chamber's Awards and Recognition Committee has looked for businesses that have positively impacted our community during this trying time. And I'm pleased to announce the committee has chosen Hapo Community Credit Union as the May Member of the Month. Hapo has been a staple in the Tri-Cities community since 1953. The Chamber is fortunate to work with Hapo staff who have held leadership positions on our board, volunteered for our Ambassador Club and other committees. They've also sponsored numerous Chamber events and programs over the years. Since the onset of the pandemic, Hapo has been giving back to the community more than ever, partnering with Whatever It Takes campaign, which raised over $70,000 for youth in our community, and also donating $20,000 in gift cards to local heroes on the front lines of the pandemic. Hapo also recently made a $10,000 donation to Second Harvest to help feed families in need. These are just a few examples of Hapo's community giving over the last year or so. So congratulations, Hapo Community Credit Union, May Member of the Month. So our sponsor of today's luncheon is Basin Pacific Insurance and Benefits. Managing partner Brad Toner and his team have created a video message for our audience today.
Basin Pacific has served the Columbia Basin since 1997, providing a wide array of insurance options, from home and auto to business and agriculture. Basin Pacific Insurance, national service, local care.
Hi, I'm Brad Toner, Managing Partner of Basin Pacific Insurance and Benefits. Basin Pacific is proud to sponsor the Tri-City Chamber of Commerce State of the Healthcare Luncheon. Basin Pacific has 18 independently owned insurance offices throughout the Northwest. We have been proudly serving the Tri-City and surrounding areas since 2010. In 2019, we merged with Manley Crop Insurance in Prosser to better serve the needs of our agribusiness clients. And in January of this year, we acquired the Othello office of Basin Pacific. We pride ourselves on providing national service with a touch of local care. We like to become partners with our customers, providing expert advice as we see it unfolding in the marketplace, and then advising you on how that will affect your business or personal life. What does national service and local care mean to you? National service means we can provide our services to our clients on a national and even international level. We have the flexibility and infrastructure to handle virtually any insurance need. Currently, we have clients' assets insured in all Western states and in other states like Wisconsin, Pennsylvania, and Illinois, to name a few. A few years ago, we insured Kurion, who had the contract to treat the contaminated water at the Fukushima nuclear power plant in Japan that was damaged by the 2011 tsunami. Most recently, we provided bonding to a client on a large project in Guam. We pride ourselves in local service. We hire very good people who enjoy being of service to others. We empower them to be proactive. We like to keep our clients informed of changes in the insurance marketplace. Recently, we sent a letter out to all of our clients and notifying them of the steep increases, upwards of 70%, in the cost of lumber and steel. This has a great effect on the replacement cost to rebuild homes in all commercial and agricultural buildings. With more and more people working from home, protection against cyber risk is more important than ever to ensure your personal data and the personal data of your clients. When it comes down to it, we're not like other insurance brokers, and we're proud of it. As the largest locally owned independent insurance agency in the Tri-Cities, we look forward to learning what is important to you and your families and your businesses. National service, local care. That is Basin Pacific Insurance and Benefits. Thank you, and thanks to the Tri-City Regional Chamber of Commerce for all they do for all of us.
Thank you, Brad, and everyone at Basin Pacific for sponsoring our luncheon today. Another really great partner. They sponsor a number of things with us per year, and we're thankful that you sponsor today's luncheon. It's always great to work with you. So now we're going to bring Shay back and turn things over to the chair of our board of directors. Shay, I don't remember the last time I saw you in person, but I feel like I'm seeing you in person, but one day we'll be somewhere live. But thanks for always making yourself available to help with our luncheons, and you do such a great job.
Oh, thank you so much, Lori. This is so much fun, and I cannot wait until I get to see you in person again. You know, we will soon get to open up, and the sun is shining, so it might be sooner than you think.
Hopefully, let's hope.
Well, thanks so much, Lori, for kicking us off. And hello to everybody watching. Let's go ahead and jump into our program because we have an exciting program for you today. For today's format, we're going to hear individual presentations from the 3 hospital CEOs. And following their presentations, all 3 CEOs would join me to answer pre-submitted questions from the audience. So kicking us off today is Reza Kaleel. Now, Reza has served as Chief Executive for Kadlec since January of 2009. He originally joined the Kadlec team in July 2016 as Chief Administrative Officer for Kadlec Regional Medical Center. Reza has worked in healthcare administration since 1997, beginning his career in strategic planning and finance before steadily working his way up through various leadership roles in health system operations. Over the course of his career, Reza has enjoyed the challenge of bringing diverse groups of talented and committed people together to solve important challenges, and he feels that working in healthcare is a lifelong career calling. Reza holds a master's degree in healthcare administration and bachelor's degree in economics from Trinity University in San Antonio, Texas. Go Tigers! And he's a fellow in the American College of Healthcare Executives. Welcome, Reza. How are you?
I'm good. Thank you, Shay. Just one correction there. I've been in this role since 2019, not 2009. So I don't want to.
Oh my gosh. Is that what I said? 2009? Well, Reza, you're so amazing at what you're doing. It just kind of feels like you've just been driving this leadership for much longer.
I've joked with folks that I had one full non-pandemic year in the CEO role before 2020 hit. So
there you go. Well, I'm excited to hear from you.
Great. Well, I'll jump in then, and thanks for having me and for having all the hospitals for this update today. I want to open with a quote that I've been pondering a lot over this last year, and it's one some of you may have heard from the former CEO of Intel, a guy named Andy Grove, who's famous for a couple of books that he's written. But he said, "Bad companies are destroyed by crisis, good companies survive them, and great companies are improved by them." And I'm a little biased, I know, but I believe Kadlec is one of those great companies that has been improved by a lot of what's happened, and we'll get into some of that today. I really want to cover three things in the brief time I have, and given that this is an economic forum. Number one, I want to talk a bit about the business context that we operate in, give you some idea of the key challenges we work with, the scope of services we provide. Second, I want to talk a little bit about, we're all tired of talking about the pandemic, I'm sure, but about how the pandemic has impacted us as a business and shifted our thinking. And just the thought, going back to that quote, that every obstacle, no matter how big, always presents opportunities. And in some ways, the bigger the obstacle, the greater the opportunity. So we'll share some positives, I think, for the future there. And third and finally, very high level, talk a little bit about what we're focused on for the future here at Kadlec. So first, some of that context I mentioned. Number one, we are the most regulated industry anywhere. And I recognize some of our colleagues in the nuclear industry here may quibble with that a little bit, and we could have an interesting discussion. But we're regulated at a local level, at a state level, at a federal level, and there's a lot that comes with that. Second thing, putting some things in context, we are a very labor and capital intensive industry, which creates some interesting challenges. On the labor side, incredible diversity. We employ everyone from the most skilled surgeons to the most skilled engineers to skilled EBS workers to nurses to medical assistants to you name it. And there's a whole broad assortment of things we get into, which is part of what makes this, I think, the best industry to work in personally. Same on the capital side, incredible diversity in what we deal with, from imaging equipment, surgical robots, to the type of facilities we manage. If you think it's expensive to try to build a house right now, and we're talking about inflation and all these kinds of things going on, try thinking about adding on to a hospital wing or something like that with the amount of codes and regulations we work with. It's daunting, especially in the current environment. Another important thing with the context that I know you'll hear from all the hospital leaders here, medicine is both private and socialized. So, well over half of the payers that we deal with are government payers, Medicare, Medicaid, that set prices for us based on what they're willing to pay. The others are negotiated with commercial, and we have a number of uninsured folks. So everyone pays a different price. There's a lot of confusion, and it's no surprise that the public is often very confused about healthcare prices and where all of this goes. We in Kadlec are part of a larger system. We joined Providence in late 2014. It was a really important step for our organization. We were looking for some key things in a partner. One was aligned mission and vision for the future. Was that aligned? Was that something we could see? And certainly that met the mark with Providence. Access to capital was very important as you look at the tower expansion we've had here, the parking garage, a number of other things over the years and things to come. That access to capital being part of a bigger system was important. The right geographic partner in terms of the facilities that we partner with in Spokane, Sacred Heart Medical Center, closest to us in that direction, provides higher level quaternary care facilities than what we provide. Our partner, St. Mary in Walla Walla, we're kind of in between those two, and others across the state it's a 13 hospital region within Providence that we're part of. Strength in clinical operations was very important, and really the right balance of local and shared system authority. So we continue to have a local community mission board that provides governance and shares governance with a regional board for a variety of things. Our local board continues to oversee quality, patient staff engagement, medical staff credentialing, community partnerships, and a number of other things. Talking about growth, which is obviously a big thing in the Tri-Cities. I don't need to talk to any of you about how this community has grown in the past couple of decades, and we've tried to grow in response to that need. This community is not quite rural, not quite urban. In my personal opinion, it's the perfect mix of both, which is why my family and I really love being here. But a guiding principle for Kadlec for many years has been keeping as much high quality care as possible locally. And much of what you see here that we've expanded into over the last number of years are things you typically see in larger population centers. And I want to talk briefly about how we think about growth. And it's more complicated than this, but a simplified version is it hinges on three things. One, looking at what's the unmet need and demand from the community. Number two, do the economics support it? Do we have the right volume to be able to do this in a sustainable way that allows us to carry on and not just do it for a short time? And third, and probably most important, is can we provide the service in a large enough volume to do it safely and with high quality? And we get a lot of questions about why aren't you in this particular line of pediatric business or this particular line of this or that? And a lot of times the answer is because we don't have enough of a critical mass in the population to have enough volume to do that safely. A growth example from this week that I'll share, we just started 2 days ago with our first TAVR procedure. So this is a transcatheter aortic valve replacement, which is a procedure, a minimally invasive procedure to replace the aortic valve in the heart. It's been done for a number of years as a cutting-edge procedure in larger quaternary care centers. And Kadlec, through our partnership with Sacred Heart, has been working and training over the past couple of years, getting our physicians and team members ready to be able to do that. And this is a new service that has been added to our cardiac service line just this week. So an example of how we think of these kinds of things. Little bit of our size and scope, again, by way of background and what we've grown to. We have a licensed 337 bed hospital here. A little trivia, I think it's the only parking garage still, multi-level parking garage still in the Tri-Cities. 33 clinic locations, primary specialty and urgent care in that. We have a healthplex here on Lee that has a 20-some outpatient services, including therapies, cardiac rehab, wound healing, and some other things. 2, soon to be 3 ambulatory surgery centers. A third is opening in the next couple of months, a dedicated endoscopy center right next to the healthplex, a freestanding emergency department in Kennewick, and 4 retail express care centers throughout the Tri-City. So that's a bit about the facilities, but the most important part of all of that is, of course, the people. We have currently, as I speak today, 3,711 employees, or caregivers, as we call them. And this has remained pretty steady over the past few years. It is roughly double the number that we had in 2009. So there was a period of a decade where we had a lot of really rapid growth. And we are continuing to grow responsibly and in the ways that I just mentioned, considering all those three things as we look into the future. Thinking about our staff a little more, about 25% of that number, that 3,711, have been with us for more than 10 years. We have a lot of longevity here, and over half have been with us for more than 5. About 900 of that work staff, or about 25%, are nurses. And if you add nurses and doctors together, that makes up about a third of our workforce. So think of the other 2/3 as being everybody else that it takes to make a health system work. About 80% of our caregivers are represented by one of 2 unions. So a WSNA for nursing, SEIU for some of the other technical and service positions. And that's an important part of how we engage with our staff, and the work that we have to do on the labor side is working closely with those unions. We employ about 325 physicians and advanced practice practitioners. About half of those are specialists. The other half are a combination of primary care and what we call hospital-based physicians and APPs, so hospitalists, ICU intensivists, neonatologists. And then we contract with a number of physicians through third-party groups. Our emergency department physicians, for example, the radiologists that support us, and anesthesiologists that work with us in surgery. So that's a little bit about our size and scope and what we are today. I want to shift now to some updates on the pandemic and how that's impacted us. And I'll start with the negative. There are obviously a couple of negative things to talk about before we get into some of the positives and moving forward through the obstacles. I heard a mental health professional that I think my colleagues probably heard as well on a Washington State Hospital Association call a few weeks ago, who likened the whole COVID situation to the Hydra from Greek mythology. If you recall, this was the 9-headed serpent that Hercules had to vanquish, and every time you cut off a head, 2 more would grow in its place. And I thought that was just apt. That's how this last year has really felt. You kind of figure one thing out and solve for it, and there's 2 more things to work through. But she also coined a term called pandemic stress disorder, which she defined as prolonged, inescapable exposure to intense stress or loss. And I think that is maybe the number one thing that's been the challenge for us, is the impact on all of our people. And this is from the frontline staff that's been caring for the patients to our leaders to really everybody that's been involved in trying to keep running a 24/7 operation through one of the most interesting times we've had. So we were having issues with burnout and shortages of staff, things like that pre-pandemic, and post we know it's going to continue to be an issue. And we've all been impacted differently. I mentioned the diversity of types of staff that we have, and so there is no one size fits all for helping to address some of these things. And we've got a whole lot of initiatives and targeted programs looking at different aspects of this and trying to help people and meet them where they are. The second thing that's probably the biggest challenge has been how far downstream this pushed us, at least temporarily. We'd been talking for years and planning around how do we reduce the utilization of expensive healthcare services in the ICU, some of those most expensive things. How do we reduce inpatient admissions by looking at outpatient, and even beginning to talk as an industry about hospital at home and different things like that. And so, as you all know, through the pandemic, the number one questions we were getting, the top questions, do you have enough ICU beds? Do you have enough ventilators? All of those furthest downstream resources that we had to quickly rally and make sure we had in place to make sure the healthcare system didn't get overwhelmed. So we're getting back to thinking about our larger system and getting out of emergency mode. On a positive front, then, I have had 2 negatives. I've got 8 positives. So I tend to be an optimistic guy when it comes to a lot of things and look for these things. So number one, really the loosening of regulations around telehealth and some of these things have allowed us to trial things that we've been working on for years and years in the real world in different settings. At one time, we had as high as 15% of our clinic visits being done virtually. And we're looking at ways to not replace in-person visits, but how do we use telehealth and telemedicine that we've already got going now to better effect to supplement all of this. And it's a work in progress, but that's been a real awakening for us, being able to work through that. Really examining holes in our supply chain. This may seem like an unobvious one, but as a country, we know we had all these issues with PPE at a national level, personal protective equipment. I think everybody knows that acronym now. But we've developed within our own system new hub and spoke models to better manage inventory and create fail-safes and redundancies that are helpful there. Third, the partnerships and collaborations just locally with everyone from the health district, the State Department of Health, Washington State Hospital Association, Tridec, who early last year stepped in, I know, to help us with trying to source PPE and other things. It's been just amazing. So we've worked closer together with folks in the community and across the state. At least since the time I've been here, I've not seen anything like it, and developed some really good relationships and working practices. Fourth, I'll call rapid iteration of emergency response. Because of how many changes there were in this pandemic, we've really dialed in what you can't do well with tabletop exercises, trying to look on emergency response and things like that. We've had real world experience now, sometimes every week, having to change the way we are either practicing in the hospital or through other parts of the healthcare system in response to the changes. And we've gotten pretty good at it. So I think it's built confidence and it's built pride, and it's built a muscle that we maybe didn't have as strong before. So that's been great. And we intend to continue with that. Fifth, I think this last year has been a wake-up call nationally and maybe even globally, starting with top leadership here, certainly, that we've got to pay more attention to issues of health equity in our community, but also diversity, equity, inclusion on our team, starting with leadership, starting with our board that's been doing some deep reflection and has already made some changes in their makeup this year. So really, really good movement on that front, and we intend to continue that. Number 6, I think we're finally beginning to destigmatize mental health. Everybody in the community, in the country, in the world, going through this trauma together, and more people realizing that they may need help in one way or another. I've used some of the same offerings that we provide to our caregivers in terms of virtual mental health visits and things that we all need a little help with from time to time. And that's been great, and I hope that continues. Number 7, we've heard and seen statistics about numbers of people that people are saying are going to leave healthcare because they've been, frustrated with what's gone on during the pandemic and all that. And certainly that's a concern for future workforce. But what I'm seeing on the other side too is there may be another group of people that's inspired to go into healthcare because of what they've seen happen. We have a lot of retirements in our industry coming from the executive level all the way down. Some of those have been accelerated by this, but I hope that we are going to see more and more people that are wanting to run toward the fire. There's always folks like that in every community that see this as a great opportunity and something they want to be part of. So that's a positive. And I'll wrap this section up by just saying I personally find the time that we're in right now energizing. There's so much possibility. There's a lot that we were working on changing even before the pandemic, and it's just allowed us to really stop and rethink a lot of things that are going to make sense for our community going forward. Last area of focus before I wrap up here, and I'm being mindful of the time, we've got really 4 strategic areas of focus, and there's many initiatives and a whole strategic plan around all of these. I just want to outline those 4 for you so you know where we're headed. Number 1 is something we call our Keystone Strategy, and we put this out in 2019 as our number 1 priority, and it's really to build a resilient, diverse, inclusive, innovative, and empathic team that's going to lead Kadlec to thrive amidst really profound accelerating change. And under that banner, we've got a lot of things going on. Leadership development, including a full integration of physician leadership and a new model we've been rolling out for the last 3 years into our organization. Continuing investments in the community and education locally with WSU and CVC to continue to build that local pipeline of talent. And then much more intentionality to come about inclusion and diversity, starting with, as I mentioned, all the way from our board level down, and how we do our work into the future. Second major priority is around improving our value proposition for consumers and payers. It's very simply best quality at lowest cost. So structures and approaches that we're taking around value-based care, things you've heard, I'm sure, from others about. An example locally, integration of cancer services into our continuum as the Tri-Cities Cancer Center banner kind of gets brought into the Kadlec fold, and how can we do that work better for all of those we serve. Third is right-sizing our capacity to meet current needs. We know we have access issues. Those of you that are new to the community looking for a primary care physician, or even others that are trying to get in to see specialists, we know very well that we have a lot of access issues. So trying to balance the growth that we need with responsible growth, all the things I mentioned before, knowing that things are going to shift, and trying to predict where things are going and build out the capacity and the services in the way they will be needed in the future. So primary care is a big important piece for us, including specialty care access, and then level 2 trauma. We live in a bit of a trauma desert. We've been pursuing turning Kadlec into a level 2 trauma center for the last few years, and are getting closer to that possibility. And then fourth and last, partnering wherever possible. We want to lead where it's appropriate, but more and more we need to look for opportunities to partner with other organizations in the community. We have a collaborative committee around population health that includes a number of leaders and different folks in the community looking at those types of opportunities. Mental health is a huge one where we think there may be opportunity to do things differently and better in partnership with others. So I will leave it there, a pretty high level. Thank you all for your time and for your partnership. I want to thank all of our healthcare workers across Kadlec, Lourdes, and Trios for everything they've done to help this past year. And we're in it for the long haul in the community, and I think the best part of our journey is ahead of us. So look forward to your questions later in the program and to hearing from my colleagues. Thank you.
Thank you so much, Reza, for that presentation and the update on Kadlec. We really appreciate all that you and your team at Kadlec are doing for our community. Next up is Joanie White-Wagoner. Joanie joined Lourdes Healthcare earlier this month as Chief Executive Officer. Joanie is a dynamic leader with extensive healthcare management experience. She most recently served as Senior Managing Director at MRN Healthcare Management in Washington, North Carolina. Before MRN, Joanie held leadership positions at several healthcare organizations across the country. And Joanie earned her Bachelor of Science in Healthcare Management from Southern Illinois University, and both a Master of Health Administration and a Master of Business Administration from the University of Maryland in College Park, Maryland. Go Terrapins! She's a fellow of the American College of Healthcare Executives, FACHE. Welcome, Joanie. Welcome to Lourdes, and welcome to the Tri-Cities community.
Thank you, Shay. Thank you very much. I am very excited to be here at Lourdes Health and in the Tri-Cities. I've only been serving as a CEO for just a few weeks now, but what a great few weeks it has really been. It's been very humbling to be welcomed to the team, and I have never experienced such an incredible feeling of warmth and welcoming as an atmosphere as I did on my first day. My experience is just a small testament to me of the wonderful and amazing people in our organization and the passion and dedication of everyone here in the area, both of all the healthcare workers. I get goosebumps just thinking about the people and the real difference that they are making in our community every single day. It's an incredible honor for me to lead this organization and serve this community that I now call home. Next slide. We have here at Lourdes nearly 900 employees on our team, and I am grateful for each and every one of them. The last several weeks, as I have rounded and met them, I have heard and seen their dedication and commitment, and it is unwavering and unparalleled. Here at Lourdes, we share a mission with our sister hospital, Trios, of making communities healthier. This means that we strive each day to do what's best for our community and to provide quality health care for those that need it the most. At Lourdes, we have an added component to our mission, however, and in that our mission is an extension of the healing ministry of Jesus Christ. We are called to serve our community, our patients, our loved ones, our coworkers with respect, compassion, and care. We respond to the healthcare needs of our community in a Christian spirit, and we strive for excellence in all that we do. We've been serving this community since 1916, for 105 years. When we first opened our doors, it was a time when healthcare was simpler and our purpose was to serve the needs of Pasco. Today, that mission has evolved and expanded, but our purpose to serve remains the same. Next slide. As we partner with Trios Health and work with our parent company, LifePoint Health, our ability to reach and serve all of the Tri-Cities has greatly expanded. We are achieving great things too. Last year, we were honored to be recognized by Healthgrades as Washington State's most recognized hospital for orthopedics. We received several other awards as well, including America's Best 100 Hospitals for Spine Surgery, the Orthopedic Surgery Excellence Award for 5 years in a row, top 10% in the nation for overall orthopedic service for 5 years in a row, and the Spine Surgery Excellence Award. We were additionally recognized with the 5-star awards in total hip replacement, hip fracture treatment, back surgery, and spinal fusion surgery. The Lourdes surgical team and our orthopedic partners have made it possible for us to receive this level of recognition. This is also a great testament to the work going on within the walls of our hospital and the level of care our patients can expect when they come and receive care from us. Next slide. And there's more. Just a few weeks ago, Lourdes Health was awarded a 5-star overall hospital quality star rating from the Centers of Medicare and Medicaid Service. Lourdes is only one of 7 hospitals in Washington State and 455 throughout the country to earn 5 stars, putting us in the top 14% of all hospitals. And we could not have achieved this without our Lourdes family. I am grateful for every team member. And again, this is a testament to the kind of care you can expect to receive when you come to Lourdes. Next slide. 2020 was a challenging year across the nation and across the world, and it's no secret why. COVID-19 changed our very way of living. We continue to fight this pandemic, but I am grateful to be able to report that hospitalizations are currently down. I am encouraged to see this trend and hopeful that it will continue as vaccinations continue. This does not, however, mean that our guard is down, though. We remain ready and continue to be prepared in the event of a spike in cases and hospitalizations. Our amazing teams have been prepared all along, and they have shown up for our patients and their families in such incredible ways. We are grateful to have recently been able to allow care partners for our patients. We all know in healthcare that an important part of healing is having your loved ones close and participating in your care. And we have appreciated the community's patience as we have sorted through this policy and worked to come up with the best plan to keep everyone safe and ensure that our patients are comfortable and receive the best care possible. Next slide. As we look to the future, I'm excited to share that we are in the process of an aggressive provider recruitment to fill our key services and ensure that we continue to increase access to quality healthcare for our community. We are excited for the plans that are in place that are still coming together, and we look forward to bringing more talented providers to Lourdes and your community very soon. I'm excited to share about our new Senior Life Solutions partnership that will be coming soon. It's an intensive outpatient group therapy program designed to meet the unique needs of our senior adults struggling with symptoms of depression and anxiety, as well as stress from age-related health concerns and difficult life transitions such as the loss of a loved one. Following an individual assessment, these unique patients will be able to meet up to 3 times per week in a supportive, encouraging group setting. The program staff will include a board-certified psychiatrist, licensed social workers, nurses, and other healthcare professionals dedicated to the emotional well-being of the seniors in our community. I look forward to sharing more about this partnership soon and to be able to serve this population in such a meaningful and needed way. Our Lourdes mobile outreach team continues to partner with local law enforcement agencies to help individuals experiencing behavioral health crises. This partnership does amazing things for our community. Our mental health professionals aim to help law enforcement provide crisis interventions, stabilization services, make referrals, reduce arrests, and ultimately de-escalate these situations. As I have learned more about this program, I have been in awe of their work and their dedication to helping people in these situations and working in tandem with our local police to achieve greater outcomes for the individuals who so desperately need them. It is a program that we hope to be able to keep going for a long time and a partnership that we are very thankful for. We've been in this community for 105 years and we're not going anywhere. We, along with Trios and LifePoint Health, are deeply invested in this community and ensuring access and stability for our healthcare services. Next slide. I want to thank everyone for your continued support and for your placing your trust in us for all of your healthcare needs. Thank you.
Joanie, thanks so much for that presentation. And again, welcome to the Tri-Cities. So far, we've heard 2 great presentations about how, from a healthcare standpoint, you're being proactive in our community and what the community needs. So we thank you for that. We have our final presentation coming up. This is from John Solheim. John joined Trios Health in August of 2018 as Chief Executive Officer when Trios was purchased by RCCH Healthcare Partners in a joint partnership with UW-Medicine. John has more than 35 years of experience as a hospital CEO, including stints in Minnesota and Montana, and John was named to Becker's Hospital Review's 50 Top Rural CEOs to Know in 2015 and 2016. He received his Master of Health Administration from the University of Minnesota. John, I should have had you scream, "Go Golden Gophers," but I did that for you. And his Bachelor of Arts, Organizational Communications and Business Administration, Hospital Administration from Concordia College. John is a fellow with the American College of Healthcare Executives and served in a variety of state and regional healthcare leadership roles, including past board member and executive committee of the Minnesota Hospital Association and the past board chair and board member of the Montana Hospital Association. John also serves on the Regional Chamber Board of Directors. Hey, John, welcome.
Hey, how are you doing? Thank you so much, Shay, for your leadership of Chamber and Lori and her staff. I just noticed I had a lot more hair back before the COVID, so that was that's kind of depressing, but it is what it is what it is. So thank you for the opportunity. In light of time, I'll be quick to go through so we allow some time. So next slide, please. So this is just a little bit about LifePoint. Again, it's a large $9 billion corporation formed in 1999, came out of HCA when they kind of divested their community and smaller hospitals. So it's been growing ever since. And again, we thrilled to work with our partner facility, Lourdes, in our community. To be honest, being part of a system during COVID was life-saving in a lot of ways. Financially support and accessing, care standards and PPE and et cetera. So we're very thrilled to be part of LifePoint and help stabilize us. Next slide. Next is just a little bit about our market review payroll. We're about 1,200 team members. We do have a local board that has a shared governance. So we do have local board members that give us input on our quality, medical staff, and strategic issues. We employ about 66 providers. And in addition, we have about 27 family practice internal medicine residents. We have 7 clinic sites. The other thing is that we're held to the same standards as other nonprofits. We call our hospitals now for-profit, but tax-paying hospitals. And then last year we paid about 1.2 million in property taxes into the state of Washington. So we're happy to contribute not only on providing access, but be tax-paying. So next slide. Just a little bit about our residency. We both have family practice residents and internal medicine. We also allow the Yakima Valley farm workers to rotate, and we really want to thank our physicians that participate in teaching. It takes a lot of time. Their commitment to be part of a teaching program, not only here, but throughout Kadlec and other community members and at Lourdes, is very much appreciated so that we can get residents that come through our facility and get a good experience. Next slide. Just about COVID, you've heard about COVID. Tri-City was hit hard. Kudos goes out to Kadlec. At what time they were serving the most COVID admissions in the entire state of Washington, and Trails had its share too. So the hardest part, besides making sure our employees were safe, was really not allowing visitors to come in. The hardest part was if they're going through a tough time, no family member was able to be there. Even though we use technology to help support that, it just wasn't enough. So that's the things that broke my heart, is just really working with family members during these difficult times to support their loved one that was in the organization. Big thanks to our staff who came in to work every day. Others were able to stay home. Our staff weren't, and that goes for Lourdes and Kadlec. It was especially tough when the schools are out. We have a lot of really focused individuals that want the best to provide patient care, but also for their family. And that was tore them at times too difficult, in a difficult spot to take care of their kids, but also to come work and serve our patients. So again, our hats off to them and our physicians that weighed into it. The other thing, like Reza talked about, we were able to adapt daily on different treatment plans. It came kind of a surprise back a year and a half ago. But by now we have a rhythm down and a good change by our doctors to constantly look at best ways to treat patients. And then we lost about 25% of our net revenue during this period. So like other businesses on this call, it was very difficult. And even though the hospital was there, a lot of our revenue went away when elective surgeries and ER volume went way down for a variety of reasons. So the good news is as of March, a lot of that volume has come back, and we're excited to serve those patients. Next slide. As far as our focus, it's all about increased access. So we're doubled our GI room so we could have more volume. We put a lab draw station, reopened outpatient rehab, which is thriving. We started interventional pain center, and then we implemented a call center. We get lots of transfers from outlying critical access hospitals in Washington and also Eastern Oregon. So it's nice to have that a one call. And then our clinic video, telephonic and televideo visits also went up dramatically during that time. And it still has a place now for people. And then we also implemented online scheduling for primary care. And so if you have a primary care physician at Trios, you can go online and schedule a next appointment without calling. Next slide. Access is still important, and so we've really recruited about 30 providers in the last 2 years and are looking for 18 this year. Mainly the 18 is around specialty care. We have a good, solid primary care base. Could always use more for growing, but we'll need more providers as this community grows, and we're committed to do that. Next slide. And then everybody asks about Trios and Lourdes UW. Between Trios and Lourdes, we share several department directors, so they're establishing standards that are same at both Lourdes and Trios. We've aligned some contracts. We have a joint medical staff development plan. We both implemented the same clinic EMR, so if you go to Trios and need to go to Lourdes, that information's on the EMR. You can easily pull it up for the doctor, and we're still developing potential synergies with UW. We're excited for that potential. UW has outstanding care and brand equity, and we want to leverage that. Next slide. The big news here is we're relocating Women and Children's of Southridge. So we're looking at a 2-story addition to come over to Southridge. It'll have 2 C-section rooms, 6 delivery rooms, 11 postpartum, 10 special care nursery, and then the remaining 18 beds from Auburn will be moved over, and the OBGYNs will be relocated in the care center all in one spot. So the construction already started. It's supposed to be completed in April of 2022. I think we'll be a little ahead of that. Projected phase 1 was $21 million with another $5 million for phase 2. For those businesses, the economics are big. We could save about $3.5 million annually because we essentially duplicated a second hospital only about 3 miles away. So getting everybody on one campus will be good. We'll always keep the DeBee Clinic. That's an anchor for those patients down in that area. And the other good news is we wanted to repurpose the Auburn campus. So we've sold parcels to the school district and the fire station and the fire department to build a new fire station. And then we're working with the county and now the hospital district on repurposing the Auburn Hospital into behavioral health options. So we're excited to redevelop that. This is a picture of our hospital campus. So the blue areas of the expansion, it faces north. So you can see that. Next slide. And I'll just quickly go through it. So that's the OB area will take up part of our surgical floor, and then it'll have its own dedicated OB unit. Next slide. That's the shelled area. Next slide is then the remaining 18 beds. So next slide. So that's just a picture. Next slide. And so open to questions. I want to thank the opportunity to quickly review what's going on at Trios and thank my colleagues Reza and Joanie for participating. Thanks a lot.
Me and John, if there was a trophy for who could give like such great information in a short amount of time, it will go to you. Nice job, and thank you for the information, John with Trios. I want to bring back Reza with Kadlec and Joanie with Lourdes. I just want to open the floor for any final remarks that you might have before we close out today. How about Reza, since you kicked us off first? Any closing remarks from you that you'd like to share with our community of viewers and listeners out there?
Sure. Yeah, a couple things. Number one, and I can't say this often enough, thank you to the whole community for the level of support that we've had over this last difficult year. The outpouring of support for our caregivers here, meals and donations of different types. The cards are actually some of the most meaningful things that I know people have held on to. Coming from organizations and churches and sort of everywhere. I get a lot of letters too personally from different people who've had a positive impact from us asking how they can contribute and things. So second thing I do want to just share, we do have 2 foundations. We're a not-for-profit healthcare system and rely on philanthropy for a lot of what we do. And so if those that have an interest want to go out there, you can go to our website, kadlec.org/foundation. Or for the Cancer Center that has its own foundation, tccancer.org/foundation. Jim Hall and Liz McLaughlin are the leaders of those foundations respectively. They would love to hear from you. And that's probably the best way I can think of for folks that are looking for a way to give back is to engage with our foundation and see if there's something that may make sense for you. And other than that, just thank you again to the whole community, to our caregivers, and to my colleagues, Joanie and John. This was great. And to you, Shay, as well, for moderating this. Thank you.
Absolutely. It's my pleasure. Thank you so much for being here. So Joanie, any last remarks to the community of listeners out there?
You know, I think Reza said it perfectly earlier when he said that the Tri-Cities is a perfect blend of urban and rural. And being new to the area, I've just been in awe of just everything in this area, both the beautiful sites as well as the beautiful people. So I do want to take this opportunity to thank everyone again for such a warm welcome.
Thank you, Joanie, for joining us. And John, bring us home. Any final comments you'd like to share?
Yeah, just remember healthcare is, we work really hard on our patient safety, and COVID. So even though there is still some COVID patients in our hospitals, it is safe to come get your healthcare needs. Don't delay any longer because it could have long-term effects. So we're open for business, ready to serve your needs in all three facilities in the Tri-Cities. So thanks for the opportunity.
Fabulous. Thank you three for joining us today. I have to say, I love that you are being so proactive on looking at the needs of our community and coming up with responses. It's amazing, just even as a member of the community, hearing these updates and knowing that you're doing everything you can to bring the best services possible to the folks in the Tri-City. So again, thank you so much for joining us here today. And thank you for joining us, listening in. We're fortunate enough to have many generous members of the Regional Chamber. And today we have a few giveaways from some of those members. The winners were randomly drawn prior to this luncheon. First, we have a box of hand sanitizer donated by Tri-Cities Battery and Universe Corporation. And the winner is, those of you out there, I need you to do a drum roll for me. All right, Leslie Streeter with Tri-Cities Chaplaincy. That is yours. And next we have a basket of goodies donated by Gisa Credit Union. The winner of the basket is, please give me a drum roll, folks out there, Harley Houston with Crown Property Management. Last, but certainly not least, we have a beautiful bouquet from Just Roses to give away. And the winner is, come on guys, I need a drum roll. I know you're sitting at a desk right now looking at this. Please, oh, there it is. There's that drum roll. Paul Giver with Meyer Architecture. Elizabeth Holt will contact you to receive your prize. And if your company would like to donate a future giveaway, let us know. We love to include you. Before I wrap up today, I'd like to thank today's guest speakers, Reza Kaleel, Joanie White-Wagoner, and John Solheim. Brad Toner and Basin Pacific Insurance and Benefits, thank you so much for sponsoring today's luncheon. And to all of you who joined us virtually this afternoon, thank you very, very, very much. A video of today's luncheon will be posted on the Chamber's YouTube channel and shared on our Facebook page. So please, please, please pass it along to your family, friends, and coworkers. I hope that you're already marking your calendar for June 23rd. That's a Wednesday. That's our next virtual luncheon. It's called Reopening Washington, Getting Back to Business. You do not want to miss this because our guest speaker is Chris Johnson, President and CEO of the Association of Washington Business. And Chris will discuss the path forward for businesses once Washington reopens on June 30th. Please go and register right now and get it on your calendar because you really, really want to make sure you get a seat to this. Make sure you go to tricityregionalchamber.com and that's where you can register. Thank you so much for joining us, guys. Go out there, enjoy one of these amazing 300 days of sunshine that we get to have in the Tri-Cities. Until next time, have a beautiful day in the Tri-Cities. Thank you.